truly understand the severity of it. Obsessive-compulsive disorder is a chronic mental disorder in which the person has recurring thoughts, also known as obsessions, and behaviors, known as compulsions, in which they feel an urge to repeat over and over. OCD stems from anxiety, which, although it seems common and natural, it can develop into an intense disorder for some people, causing intense fear and paralyzing dread.
Some kid that just can't get anything perfect. Like, he's a 99%, not 100%. It's kind of sad.
OCD means when you want to perfect something and you have an obsession with perfecting that.
Okay. People that are compulsive, they can't necessarily stay focused all the time. They always have to be like cleaning, ordering stuff. Okay.
Having OCD is much more intense than what people can imagine. Doing your laundry every night is an OCD. Washing your hands so often that they bleed from how much you wash them is a symptom of OCD. Being neat and orderly does not make you OCD. In order to have this disorder, patients take everyday normal actions like double-checking that the stove is turned off and repeat this action obsessively. These behaviors are used to relieve the patients from intense anxiety.
Turning off the stove is an example of things that people with OCD have trouble doing. In their brains, they have bad thoughts, such as that their house would burn down or their child will die. Obsession themes would include fear of dirt or contamination, needing things to be symmetrical or in order, aggressive thoughts about self-harm or harming others, and unwanted thoughts, such as aggression, sexual or religious subjects. Examples of obsessive signs or symptoms would include fear of being contaminated by objects that others have touched before, doubts if you have locked the door or turned off the stove, intense stress when objects aren't orderly or facing the correct way, images of hurting yourself or others that are unwanted and make you uncomfortable, thoughts of shouting obscenities and acting inappropriately that are unwanted and make you uncomfortable, and lastly, avoiding situations that trigger the obsession, like shaking someone's hand.
I would say fidgeting, maybe restlessness in the class, maybe fatigue, excessive fatigue, maybe meticulous attention to detail. Those are the things I'd look for.
I think the symptoms of OCD include nervous behavior and a need for everything to be organized and tidy.
OCD, it's like when you try to perfect something like too much that you really get like obsessed about it. So it's like very dangerous for you, I guess, because you might get obsessed about that one thing and you keep trying to do it so much.
There isn't an exact cause of OCD or any anxiety disorder for that matter, but there could be risk factors that can influence your fears in the future. These can include genetics. Some researchers have detected 17 different genes that could possibly be related to anxiety disorders, childhood traumas, brain chemistry, and functioning. Living with OCD is extremely difficult. Having family members with OCD means having a lot of patience and willingness to help that person. If you see someone in the street having a hard time, have compassion and sympathy because they might be going through a lot that you're not aware of.